We've told you about the state's new task force on racial disparities in response to this crisis. About 40% of the people who have died in Michigan have been African American, even though they make up less than 15% of the state's population. Lieutenant Governor Garland Gilchrist will be leading the task force and says he's lost 15 people in his life to the virus. Today, I spoke with the chief medical officer at Priority Health for perspective on what the group will be looking at and why it's necessary.
Things like social determinants of health, access to care, and some of the structural inequities that are out there are really at the core of what we need to address and understand better.
In terms of expanding that access to care, are there any other specifics that you think would need to be put in place in order to help bridge that gap?
I do think education is really critical. Much of the education that's out there currently around general health care, but even specifically related to COVID-19, isn't culturally appropriate. And so we have to get the education culturally appropriate when we tell people, well, you need to socially distance, not recognizing that many homes have intergenerational activity going on. The concept of how do you isolate somebody may not make sense. Some of the simple things about giving it, well, we gave the message to the mother, and typically we think the mother's going to be in charge. It may be in a Hispanic community or in a family that there's an alpha daughter that's in charge. And if you don't address that solution in the proper language to the right person, the message isn't received and isn't disseminated. So I think we just have to be very intentional.
There have been some people who are saying that the task force isn't necessary, that the state's wasting its time by forming it in order to look into these disparities. How do you respond to people who have been critical of it?
Well, I think there are so many unknowns that we need to pay attention. I think that this is a community that's been identified. It happens to be a minority community, but it's a community that's been identified with a unique problem, and a unique solution is needed. So I'm going to just say I'm in support of this task force, very much so. I think when we talk about what can actually be done to make things better, the solutions will cover the entire state. And they'll cover communities, not only the African American community, but some of the other common minority communities that we have. For example, the Hispanic community. There's a Myanmar community here in Grand Rapids proper. All of those are impacted by the kinds of solutions that I think we need to get after.